Hi guys, welcome back to my channel. I'm Ada. In this episode, I'm going to continue my discussion about self-care. So today I'm talking about teeth, all right? How to take care of our teeth. So I have a story to tell you guys. So if you are interested in hearing my story about my teeth or my journey with taking care of my teeth, then stay tuned, all right? And if you are subscribed to me, thank you for subscribing. If you haven't subscribed yet, subscribe so you can hear all of these tips that I have, okay, about self-care and other things. I talk about beauty, lifestyle, fashion, okay? So subscribe so you can get all of these tips. So, all right, how to take care of our teeth is what I'm talking about in this episode. But I'm going to share with you guys a story of my journey of taking care of my teeth. All right. So, like, we know that our teeth is very important. It's an important part of our body, right? We use it to chew, or we need it to chew. We need it to smile. We need it to hold our facial structure together. When people have missing teeth, their face is not going to look normal. It's going to be sucked in something like that, and that doesn't look good. Okay, that is why when people lose their teeth, they get false teeth, because you really just need something to hold your face together. Otherwise it looks funny, right? So yeah, so we have to take care of our teeth, otherwise we could lose it. And then when you lose it, you either have to just go without teeth and have that sucked in cheek, you know, like that, or you'd have to get fake teeth, which is expensive and it is not natural, right? So I don't know if you've seen people with false teeth. A lot of times it's like it looks scary, it's moving around, and that kind of thing. But I guess it's an alternative that is better than nothing. But the best solution is to take care of your teeth so that you don't have to have an alternative, right? So taking care of your teeth involves, just making sure that you brush it regularly. You want to brush your teeth on a regular basis. The dentist suggests that you brush it after every meal. I know that's not realistic because, even I don't do that. But you have to make sure you brush it at least once a day. That is my thing. It's like you got to brush it at least first thing in the morning. Every day you got to brush your teeth, right? And then the dentist also recommends that you floss. I think flossing is very important because that is how you're able to remove those food particles. After you eat, you can use the floss and remove the particles that are in between your teeth that toothbrush can't really get rid of. Now that one is a necessity, all right, because those food particles tend to rot in between your teeth if you don't remove them. And they, once they rot, they could cause tooth decay, they could cause cavities, and all of that stuff. So that's why it is important to floss, right? So I recommend flossing, definitely floss. So, but for sure, brush your teeth every single day. And sometimes, depending on, for normal people, or, you don't have any teeth problem, you can just use regular toothpaste. Like there are different brands, Crest. There's, different, I don't remember what all the different ones, but there are different brands that you can use. And these toothpastes you can buy them anywhere. You can buy them from the Dollar Tree store. You can buy them from Walmart, Kmart, Target, different stores, right? So, depending on what store is in your area or where you're located, I know this is worldwide, so you should know where these things are sold, and you try to buy it and use it so that you keep your teeth clean, because you don't want to lose your teeth. I'll tell you guys the story of my teeth journey, right? So when I was a little girl, I saw people with bad teeth. I'm talking about decayed teeth. I'm talking about crooked teeth, like their teeth are going all kind of directions, And I remember as a little girl saying to myself, I don't want my teeth like that, So for that reason, I worked hard growing up to make sure that I took care of my teeth. And when I say I worked hard, I just mean I cleaned my teeth all the time. I made sure that I brushed my teeth. And even as I was losing my teeth as a little girl, I heard that, when your teeth is growing back, if you just use your tongue and just push on it, if it's going the wrong direction, if you use your tongue to move it around, push on it. Like if it's, like this tooth here, you just use your tongue and push on it. And, it depends on which direction it's going. Then you use your tongue to try to reposition it. And I think it worked because now there are braces. And that's exactly what braces do. Braces, try to push your teeth in the right direction. So for me, I use my tongue to do that job. All right. And I have straight teeth. And I get lots of compliments of all the things in my body. My teeth are the thing that I get the most compliment on. And, they're pearl white. I remember when I was, even as a young adult, before I started drinking coffee, I used to get compliments all the time about how clean, how white my teeth were, and how straight they were. So I had really good teeth all my life. And for that reason, I really never went to the dentist, even when I had medical insurance and dental insurance. As I, became an adult and started working for the county, I had medical and dental insurance, but I never used it because I didn't need to. I took good care of my teeth and I got compliments on it. So I felt, I saw no reason to go to the dentist. So my very first time of going to the dentist, I was in my late 20s. And that was when I had my first child. After I had my first child, my teeth became loose. And that was the only reason I went to the dentist, was because I felt like my teeth were loose, because when you're pregnant, the baby sucks up everything in your body, right? So I think that's the reason. So my teeth weakened and I went to the dentist, and even the dentist paid me a compliment on my teeth. She was like, "Ooh, you have perfect teeth." That's what she said. And, and I was like, "I have never been to the dentist." And she was like, "Are you kidding me? You've never been?" I had never been to the dentist. That was my very first time. And she told me that my teeth were perfect, right? There were no problems with my teeth except they were loose. So she treated the loosening of the teeth, and, she kind of explained to me that it was probably due to the pregnancy and all that. So, I thanked her and I went about my business. And then 3 babies later, by the time I had my 4th baby, I would say that I was depressed and really not a happy camper. And so I didn't take care of myself, especially my teeth. There were days that I didn't even brush my teeth. I was too tired, or I was just worn out. That pregnancy drained me. I was really, and it depressed me as well. So you know how when you're depressed, you really don't want to do anything. So there were days that I just didn't even brush my teeth, right? So by the end of that pregnancy, honey, I had some serious teeth problem. So I went to the dentist again, and this time the dentist told me that I had tooth decay. I had, what did she call it? Or was it he? What did he call it? He said it was, he said I had gum disease. I was like, yeah, that makes sense. Of course, I hadn't brushed my teeth, and there were days I didn't brush my teeth, so that made sense. I didn't argue with him. I'm like, yeah, I'm sure I do, So yeah, I had gum disease. Some of my teeth, like around the wisdom area and, the teeth surrounding it were loose and infected with the gum germs or whatever. And so, he treated my teeth, extracted some of them, and then gave me an oral. And then he discovered, at that time, that's when he discovered that not only the back teeth were loose, those ones he extracted, just removed them because I don't really need them, the wisdom and the ones surrounding it, you don't really need those teeth. So, they were infected and stuff. So he removed those ones. But this tooth right here was loose, honey. And, he was like, well, uh, you don't want to lose this tooth because then you would need a fake tooth there. And I was like, no, I don't want a fake tooth, right? So he didn't want to remove it either. And so he gave me two options. He said either I can remove it or I can do, what did he call it? He said he could do I forgot what it's called, but some kind of treatment where he needed to, treat the root of it. I don't know. I don't think it was a root canal, but some kind of treatment that he needed to do. But I didn't. I was like, "What's the third option?" He said the third option is that you can just leave it and just manage it like that. And then he prescribed me a mouthwash, prescription strength mouthwash for me to use for about a month or so. And, he said that will kill all the germs. And then, hopefully this will start to heal a little bit. And then he told me to use, because my teeth at that point, or this tooth at that point, was super sensitive because I guess the gum disease had eaten the gum enough that my nerves are now exposed. So that's why it's weak and that's why it's sensitive. So when I drink hot or cold water, hot water or cold water or anything hot or cold, it hurts, right? It feels sensitive. So he said, it's going to feel like that, but there is a toothpaste that you can use to kind of control the sensitivity. It's not going to cure it. There is no cure except the thing that he told me. But, it will control the sensitivity there. And, that's the third option. So I took the third option. I don't want my tooth removed and I don't want any, So anyways, I took the third option and I started using the anti-sensitivity toothpaste, Sensodyne. It's called Sensodyne, all right? So I started using Sensodyne and, that became my toothpaste. And it helps a lot. It works. It kind of took it away until I stopped using it, and then it came back. The sensitivity came back. But as long as I was using it, I was fine. And it's been 13 years. Yeah, it's been a long time. It's been 13 years since I, had that problem, and my tooth, that sensitive tooth, is still there and it's still manageable. As long as I use the Sensodyne, I'm cool. I can drink hot, cold, and it's not as sensitive. All right. So yeah. So you guys got to take care of your teeth. You don't want to have those kind of situations. And I remember during that pregnancy also, I used to have dreams about losing all of my teeth. Guys, I'm not kidding you. I would have a dream about, oh my gosh, I'm waking up and all my teeth is just falling into my hands. I'm spitting them out. So you don't want that. You don't want that. You got to take care of your teeth so that you can have your teeth for as long as possible, because you need your teeth to chew your food. You need your teeth to look good, right? To smile, because if you don't have any teeth, it's kind of hard to smile. Like I said, you're gonna look like this. Nobody wants to look like that, okay? Yeah, so the teeth is what's giving you this, this structure here. Without the tooth, this will be all sucked in, and we don't want to look like that. So we are going to take care of our teeth so that we don't look like that. All right, we don't look like we're having missing teeth. Yeah, so that is my story. That is, my that's what I wanted to talk about today, to help you take better care of your teeth. Okay, so you guys, if you are like me and you have sensitive teeth, Sensodyne works. It does. And if you're having issues with your teeth, go to your dentist and ask them, to do something. They will prescribe you something. You have gum disease and whatnot. They can help you take care of it so that you don't end up losing all or some of your teeth. Okay, we need all of our teeth. All right, yeah, my teeth, I think they're still good, but I've, over the years as I started working and being really busy, I started to drink coffee, and my teeth aren't as white, as probably white as they used to be, but they're still straight. They're still good. So I am happy about that. I am quite pleased with how they still look. So please take care of your teeth. Make sure that you brush every day, floss, as often as you can. I'm not going to say floss every day because I don't do that, but that's what we're supposed to do. But try and do it as much as possible. After each meal, you just use your flosser and take, remove some of those, food particles that are in between your teeth, okay? So that you can have good teeth, y'all. All right. Thank you for watching. Subscribe so you can catch more of my advice. All right. And I will see you in my next episode. All right. Bye-bye.